my name is Abby, and I'm going to be performing an oral mech exam on my patient here, Sophia. So, an oral mech exam talks about your speech characteristics. So this includes your pitch, your loudness, your resonance, your articulation, and all of that. So it uses your lips and your jaw as your facial area, and as your oral area, it's your soft palate and your tongue. So before we get started, I do have a couple of questions to ask you. So what is your age and your gender?
I'm a 20-year-old female.
Okay. Do you have any medical history that could contribute to swallowing or articulation problems?
No.
Have you had any prior speech therapy? And explain to me in what areas have you had it, if you had?
Yes, I've had articulation problems with my front sounds.
Okay. Do you have any complaints about your speech or your swallowing today?
No.
So I would say your volume's about average, the pace is about average, and the articulation is quite clear.
Yep.
Okay, you ready to get started?
Yeah.
Okay, so first we're going to test the strength of your lips. So for the strength of your lips, I'm going to take my thumb and my index finger on both hands and push down while you try and purse your lips together. Ready? Okay. Next, we're going to move on to the symmetry of her lips. So she's just going to do a couple smiles for me. Okay, and now for the range of motion, just do a pucker. So that's just going to be a duck face and then smile for me 2 to 3 times. Okay, and now we're going to move to the jaw. So for the jaw, for the symmetry, you're just going to move your jaw left and right for me. Do that a couple times. Okay, for the range of motion of your jaw, just open and close a few times for me. Okay, so next for the strength of your jaw, I'm going to put my hand under your chin, and you're going to try and close it while I'm putting pressure for you to open it. Okay, next we're going to move on to the tongue. So for the strength of your tongue, I'm going to use this, and you're going to push your tongue against it and on the tip as well, okay?
Sounds good.
Next, we're going to do the symmetry of your tongue. So just stick your tongue out 2 to 3 times for me. Okay, and then for the range of motion of your tongue, she's just going to move her tongue left, right, and then up towards her nose and down towards her chin. So just do that 2 or 3 times. Okay, good. And then finally, we're going to move on to your soft palate. So for your soft palate, we're going to test the strength and the symmetry by saying ah. So it's going to be one long sustained ah, and do that just 2 or 3 times for me. I'm going to look in your mouth while you do this, if that's completely okay.
Yes.
Okay. As wide
Ah.
open as you can.
Ah.
And one more time.
Ah.
Okay. And now we're going to do the range of motion. So the range of motion is slightly different. She's going to say ah, 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 but it's going to be broken up instead of all together.
Mhm.
Okay? And can I look in your mouth?
Yep.
Okay.
Ah. 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 Ah.
Okay, good. So that is how you perform an oral motor exam. So now we're going to move into a diodokinetic exam. So a diodokinetic exam examines speech sounds, but also using different types of articulators. So in this example, we're going to be saying pa-ta-ka, but we're going to separate it into pa, ta, and ka. So first you're going to say pa, 5 seconds, as many times as you can. And this is just going to use your lips, okay?
Okay.
Ready?
Mhm.
Go ahead.
Pa 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 pa.
Okay, now we're going to move on to ta. So this is using your tongue and your hard palate. So whenever, or your tongue and your alveolar ridge. So whenever you're ready.
Yep. Ta 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 ta.
Okay, and then finally we're going to move on to ka. So this includes your tongue and your hard palate. Okay?
Okay.
Ready?
Yep. Ka 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 ka.
Okay. And then finally, she's going to say buttercup. And it's the same thing. She's going to combine them all and then say buttercup 5 seconds as many times as you can.
Buttercup, 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 buttercup.
Okay, so that is how you perform an oral mech exam and a diodokinetic exam. Thank you to my patient here, Sophia. So, thank you.